我2个儿子已经住院1个月了，第1个儿子住院10天，刚住院2天，这个儿子又住院了。
并取得一定进展。
I think it's starting to take root here in the United States. I think it's taking root in Washington, D.C.
Warren County is seeing an outbreak in pediatric pneumonia cases.
December 7th this year marks the one-year anniversary of China's de facto abandonment of its dynamic zero-COVID policy. The previously implemented 3-year-long containment measures profoundly altered society and daily life. And now, a new respiratory infectious disease is spreading across China, with many children's hospitals overwhelmed, COVID-19 testing resuming, and health codes returning. The question arises, has the nightmare of zero COVID truly ended for the Chinese people? Recently, respiratory infectious diseases have erupted in various parts of China, with incidents rising over the past few months. Children's hospitals, particularly in Beijing and Shanghai, are seeing surging queues, with a dramatic increase in pediatric visits. Kindergartens and schools across the country are suspending classes, with many teachers showing symptoms like fever and cough. Doctors warn that this year's respiratory disease season seems to be more severe than in previous years. To date, the National Health Commission has not published specific statistical data on the increase in respiratory disease cases. However, according to information released by the local government, a children's hospital in Anhui conducted 67 bronchoscopy examinations in a single day at the peak of the outbreak, compared to an average of 10 per day under normal circumstances. Official media in Hangzhou, a city in eastern China, reported that a local hospital's pediatric outpatient volume has doubled compared to the COVID-19 period last year. The report noted that about 30 to 40% of the children seen were diagnosed with mycoplasma pneumonia. Currently, Chinese officials have not confirmed any cases of death, but social media users have reported deaths, including a 7-year-old child from mycoplasma-induced white lung pneumonia and a 4-year-old child who died of meningitis following a viral brain infection. There is growing concern as this year marks China's first winter since deciding to abandon its pandemic control measures. Regarding whether the current outbreak of respiratory diseases is due to viral mutations, Chinese government officials have attributed these diseases to known pathogens such as influenza and mycoplasma pneumonia, typically causing mild illnesses in children. However, some news and social media reports suggest that despite unclear explanations of the specific causes, there is evidence indicating the Chinese government might consider these diseases to be COVID variants. Several hospitals in Beijing have asked children with fever to undergo PCR testing in pediatric emergency rooms and have implemented triage for patients. China's Ministry of Education has also issued notices urging schools to strengthen prevention and control propaganda for COVID-19 and other epidemic diseases. Staff at Shanghai Pudong International Airport reported that many foreign passengers are required to undergo rapid COVID-19 screening upon arrival. On December 4th, the Office of the National Health Commission issued a notice guiding grassroots medical and health institutions to provide comprehensive health services for respiratory diseases during the winter and spring seasons. The notice called for all local primary medical and health institutions to be open to children and not to refuse treatment, as well as extending service hours. On the same day, the Ministry of Education also issued a notice requiring schools at all levels to carry out epidemic prevention and control work during the winter. Notably, in this 34th document issued by the Ministry of Education, the term COVID-19 is mentioned at least 6 times. As the outside world questions whether China is truly experiencing a new wave of the pandemic, the Office of the Food Security Coordination Working Group of the Yiwu City government in Zhejiang province issued a call to action to all citizens on December 1st. The statement urged urban and rural residents to ensure a minimum of 10 days' worth of grain supply based on their daily consumption. Government agencies, people's organizations, enterprises, schools, the general public, and grain companies were encouraged to actively participate in societal grain storage. Additionally, cafeterias and restaurants of all work departments and units were instructed to maintain stockpiles not less than 15 days of last year's daily consumption. Notably, this call to action was later deleted, leading to further attention and speculation. It is reported that this year, children infected with Mycoplasma pneumonia generally exhibit more severe symptoms, with pneumonia developing after 2 to 3 days of fever, and some young children experiencing conditions like white lung and brain infarction. On December 27th, an article in the world-renowned scientific journal Nature pointed out several unusual aspects behind the surge in respiratory disease cases in China. One such example is the typically easy-to-cure bacterial infection Mycoplasma pneumonia, now having severe effects in Chinese children. After the relaxation of COVID-19 measures, while some countries commonly saw viral infections, China is experiencing a bacterial infection. Media reports noted a case in Fengtai district where a fourth-grade boy named Chi showed symptoms such as coughing, fatigue, and lethargy. His parents quickly took him to the hospital, but his mycoplasma test came back negative. After 3 days of taking antibiotics prescribed by the doctor, the child developed white lung pneumonia. Returning to the hospital, they found over 600 children in line needing hospitalization, leaving Chi to receive only conservative outpatient treatment. In response to the ongoing spread of respiratory infectious diseases in China, the World Health Organization has urged China to provide more detailed information. Chinese authorities have stated that no unusual or new pathogens or abnormal clinical phenomena have been detected, and the increase in respiratory diseases has not led to an overload of patient numbers in hospitals. However, many public health experts express skepticism given the Chinese government's past practice of concealing outbreaks and delaying responses. Since late 2019, the Chinese government has been accused of hiding the truth about the COVID-19 pandemic from its people and the world, controlling independent media, censoring online news and messages to cover up crucial information, leading to a global pandemic that has caused nearly 7 million deaths. At the same time as the ongoing respiratory disease in China, in the United States, 2 states are currently experiencing a surge in pediatric pneumonia cases. This has raised concerns among doctors that the outbreak could spread further. In Warren County, just 30 miles outside of Cincinnati, Ohio, there are now 142 confirmed cases of white lung syndrome in children, and the number is climbing. Local health officials have described this figure as alarmingly high. In March this year, the WHO publicly accused Chinese officials of hiding research that could link the origin of coronavirus to wild animals, questioning why this data was not published 3 years ago and why it has now disappeared. Before the data was deleted from a scientific database, an international team of virus experts downloaded and began analyzing this study. The research was published online in January. They suggested that the pandemic might have started from the illegal trade of minks in the Wuhan seafood market infecting humans. However, when these experts proposed collaborating with Chinese counterparts for analysis, these genetic sequences were deleted. WHO Director General Tedros Ghebreyesus stated these data could and should have been presented 3 years ago. He noted the need for immediate sharing of these missing evidences with the international community. The Chinese authorities' habitual concealment of facts has raised concerns in the international community, with many countries fearing a repeat of the tragedy from 3 years ago. Many countries are now considering necessary measures against the latest infections in China. Republican members of the U.S. Congress have jointly written to the Centers for Disease Control and Prevention, urging the agency to monitor China's epidemic situation. On November 30th, the new CDC Director Mandy Cohen attended her first U.S. congressional hearing, where members expressed concern over the escalating epidemic in China and questioned the transparency of Chinese data, fearing a repeat of the COVID-19 outbreak. On December 1st, U.S. Senate Intelligence Committee Vice Chairman Marco Rubio and 5 other senators jointly wrote to President Biden requesting the U.S. government to ban travel between the U.S. and China. In Japan, as early as October 24th, the Japanese Health and Labor Minister Keizo Takemi had expressed concern about the spread of pneumonia among children in China, stating, "We have conveyed to the Chinese government our hope that they will provide information through diplomatic channels. We will continue to cooperate with infectious disease crisis management agencies to collect information and respond." Neighboring countries around China, including Taiwan, India, Thailand, and Nepal, have expressed concern over China's latest outbreak of respiratory diseases and have immediately taken preventive measures or strengthened monitoring. On November 25th, Taiwan's health minister announced that ports and airports are on high alert, advising the elderly and young children against unnecessary travel, and requiring travelers from mainland China, Hong Kong, and Macau to declare their travel history and seek immediate treatment if symptoms appear. Meanwhile, the PCR certificates and health codes that have been a part of Chinese citizens' lives for years are making a comeback. According to a document from the China Textile Economic Information Network, the 2023 China National Textile and Apparel Council Science and Technology Award ceremony, held on December 6th at the Great Hall of the People in Beijing, required attendees to provide a negative PCR test result within 24 hours of entry, arranged by the event organizers. Online images show that representatives of the China National Textile and Apparel Council underwent PCR testing on the morning of December 5th at the east side of the lobby on the first floor of the PICC building. External representatives were tested in the afternoon at the Capitol Hotel lobby, with them being collectively transported to the venue by the event organizers. Attendees also had to carry their identification documents to the event. One guest even had to show a PCR test certificate in exchange for an invitation to the Great Hall of the People. Simultaneously, Shanghai authorities have also required entrants to undergo testing. As of December 1st, netizens revealed that the Green Code, which had been offline for a year, reappeared in places like Sichuan and Guangdong. Images showed the Tianfu Health Code in Sichuan and the Yuekang Code in Guangdong, both displaying the Green Code around 5 p.m. on December 1st. Additionally, the Health Code in regions including Sichuan, Guangzhou, Fujian, Zhejiang, Hubei, Hebei, Shanxi, Tianjin, and others have also come back online, and PCR testing has quietly resumed in some places such as Shanghai Airport and Guangzhou. Many netizens expressed concern about the resurgence of the Health Code. News reports say the health codes are making a comeback. I logged in and went through real name authentication, and the familiar Green Code is back. Oh my heart skipped a beat seeing this word. I don't want to see this code again. It's starting all over. 4 years later, I can't believe this Green Code is still around. Weren't they supposed to go offline and delete all the data? The code is back. I'm a bit scared. After a year's break, it's returned, which is terrifying. Can we get past this code? Netizens expressed concern over the revival of the health code system in China, which has caused significant inconvenience to people over an extended period. In the past 3 years, due to its high usage frequency, the health code has almost become a new type of identity marker that people need to use daily. While it has played an important role in risk prevention and control, it has also often become a tool for restricting personal freedoms. The COVID-19 pandemic provided Chinese leader Xi Jinping with sufficient reason to allow the Chinese Communist Party to further penetrate the lives of its 1.4 billion people. The foundation of this surveillance method is the health code system. According to Chinese media reports, the health code collects user information, including personal identity information, names, phone numbers, ID numbers, and even facial recognition data. The health code system is shared with the Chinese police, and in some provinces and cities, the health code is even jointly developed and issued by the police. Local governments collaborate with technology companies to create user profiles based on geographical location, travel history, nucleic acid test results, and other health data. The color of the health code, which includes green, yellow, or red, determines whether the holder has the right to enter buildings or public places. The enforcement of the health code is largely in the hands of local officials, who have the authority to impose quarantine measures on citizens or restrict their activities. In the past few years, almost everyone moving between cities in China, including incoming travelers, has been required to provide a travel code to prove whether they have been to areas with COVID-19 outbreaks in the last 14 days. Local governments can then decide whether to impose mandatory quarantine based on the travel code results. Even before the pandemic, China was already a surveillance state. According to research by IHS Markit, in 2018, there were approximately 350 million cameras in China, averaging 1 camera for every 4.1 people. Projections indicated that by 2021, the number of cameras in China could reach 1 billion. During the pandemic, the Chinese government fully utilized its ubiquitous surveillance system. In addition to controlling people's movements through the health code, China also used dash cams and cameras at train stations, airports, and streets to identify individuals with the virus, contacts of COVID-19 patients, and those violating quarantine or not following regulations. To better monitor people in home quarantine, some communities even installed cameras at the doors of these individuals' homes, and some even inside their living rooms. It has been pointed out that the health code, in conjunction with big data, has turned the whole of China into a large prison, with everyone seemingly wearing electronic shackles and under constant surveillance.